So welcome everybody. As Lucy said, this is the fourth time we've done the weekly open invite for staff to join us through Zoom, just to give you an update of what's going on nationally, locally, key issues in the Trust, and also an opportunity if people do want to ask questions to use the chat function. Okay, so we allow 30 minutes for this, and if you've got any questions that you either can't use the chat function for or that are arising outside of this, please just drop an email to the corona.virus@nhs.net inbox. We've had some questions that have come up in the past week that I'm going to answer at the end of today's session. So just to reassure you, the questions do get looked at and we respond as much as possible, and are incorporating some of the feedback and the questions that you've got in how we are responding to the current pandemic. So hopefully some of these will be familiar to people that have joined us, because this is the work that's been done by our staff, and they've kindly shared through social media with the comms team some of the photos of how our staff are taking part in showing thanks and appreciation to all the essential health and care workers and other essential workers that we know are making a difference day to day in caring for patients, but all of the companies that are making a huge difference to us to enable us to keep coming into work safely and to do our job. We're all part of the same community at the end of the day, and it's important that we continue to celebrate and show thanks and appreciation for one another. So some things that I just wanted to make sure people have had an update on. We do include these in each of the daily emails that are going out to all of our staff. And of course, this is all available on the internet site now, as well as the intranet site. We've been doing that for a number of weeks, recognising that a lot of staff are working remotely. So testing for NHS staff has gone live at the end of last week, and we have some of our staff that have taken part in that over the weekend and each day this week. And there's now a new facility that's opened at Temple Green. So our HR team are contacting staff that we know are currently self-isolating or at home because there's a family member that's got COVID, to make sure that you're aware that you can access those tests and explain how to go and go about it. Obviously, the tests are available for anybody that's employed by Leeds and York Partnership Trust through the routes that we've got. What we know at the moment is it means that for staff in York, they are having to travel to Leeds, but we're having a conversation with the CCG in York about what arrangements are going to be made available there. And Sophie Roberts, our clinical lead, has been part of those conversations. So we are working on it, and as soon as we've got more information, we'll let you know. I just wanted to give a bit of an update on what was happening in relation to the Nightingale Hospital in Harrogate. So today the induction has started for staff there, and we've had some of our own staff volunteer, our registered nurses and healthcare support workers and pharmacists to be part of the core team. And the aim is to look at the unit opening next week to be able to take patients that have been through the acute trust first. But there's also a separate piece of work that we've been supporting, led by Peter Trigwell and now Joseph Faulkner. So when the unit opens, we will be putting in place a 24-hour psychiatric liaison rota to provide advice and support to the clinical team in the Nightingale, like they would do in any other acute hospital, should they need it for the patients that they're caring for. And the work that Joseph is now involved in is how do we make available mental health support for staff that are working in the Nightingale Hospital. So huge thank you to both of them for leading that work. It is an effort that is engaging all of the mental health providers in Yorkshire and down into South Yorkshire, Humber Coast and Vale as well, not just our own organisation, so that everybody's volunteering staff to help that come to life basically and get up and running in what has been a very short space of time. A couple of other areas just to update you on is there is a national conversation taking place about the changes that are available under the COVID bill in relation to the Mental Health Act and whether those should be turned on or not at the moment. There is a meeting taking place today with the Secretary of State to look at the evidence of where people are experiencing pressures elsewhere in the country and whether we believe now is the right time to invoke those amendments. The sense at the moment is we're not there yet. We don't need to enact those changes, but we need to agree a process that should we reach that point, how quickly can they be enacted to make sure that staff can act quickly in order to safeguard our patients under the Mental Health Act as quickly as possible and not to have to experience any delays, which none of us would want. You also have seen from the news coverage is where they're tracking the rate of spread of COVID, and a sense that we're not going to hit the peak in the way that was predicted a number of weeks ago, which is positive. So that means essentially there will be enough capacity in the acute hospitals to cope with the demand of people who need hospital treatment. The flip side of that is potentially we're going to see a higher level of rates of infection that we're currently experiencing now sustained for a longer period of time. So what's important for us is to think about, well, how do we sustain the response that we've currently got in place and continue to maintain the same level of service? And what does that mean for all of those citizens, our own family members, ourselves, that would routinely access health and care for different reasons that aren't currently? Because what we don't want to do is deal with a pandemic like COVID and have a whole load of unmet need, especially mental health need, and how do we make sure that we're gearing up for looking at in the longer term. So those are ongoing conversations both within the Leeds system and the West Yorkshire system, as well as at a national level. So I just wanted just to know that that is very much part of the thinking and the planning at the moment. So a bit more of what's happening in the Trust. So things have changed quite a lot in the past week, and this is what we anticipated, is that once we've got the first couple of cases of COVID, is that we were likely to see that spread more quickly, and that's because most people who are positive for COVID in the first few days aren't symptomatic. So we've now got 13 cases confirmed within the Trust. All of those are being appropriately and safely cared for within our wards, within our specialist supported living service as well. So a huge thank you. From reviewing and getting the feedback on those cases every day, I know that the staff are absolutely providing the best possible personalised care to those patients, like we would expect any other time of the year, whether they've got COVID or not. Very sadly, over the bank holiday weekend, our specialised supported living services lost one of their residents who has been known to those staff for many, many years, and obviously that's very traumatic for our staff. For me, it's the same as losing a family member. The relationships we have with our service users is very much about those long-term relationships we have with people. So it's really important that we acknowledge the way that grief affects us. I think there's a danger that we try and over-professionalise our response when we're feeling genuine bereavement for people that we've lost. We don't put a superhero cape on when we come into work and switch off our feelings, and that's about being able to talk to people around you, those that you trust, in the way that you would normally do in any other circumstance, and I just want our staff to be able to continue to do that. We're in the process of redeploying staff, and we've already done that, so a huge thank you to those staff that have already moved teams. We agreed this morning as well for the next cohort of staff that that typically work in corporate services. We've had quite a number volunteer to be retrained so that can be redeployed into our clinical teams, so that's all plans that are now currently underway. So again, a huge thank you. And as part of that is making sure that we're putting the right support in place for our staff. So we've already rolled out the free meals at all our inpatient sites a few weeks ago, introducing grab bag meals, and our HR staff continuing to call those colleagues that are at home self-isolating, just to make sure that we're keeping them in touch, they know what's going on in the organisation and any support that they may need. We've also now stepped up the occupational health helpline for staff that do need that additional support, and you can just go onto the website to find that, as well as the details for the national helpline for staff. So those are all available as and when staff feel that they need them, that they would be beneficial to them. And in the meantime, it's very much making sure that staff are getting adequate supervision and support from their line managers and clinical supervisors day to day into the challenges of the job. One of the things, sorry, before I go on to this, just to make sure everybody now knows, Thursday last week, the mother and baby unit successfully moved from the Mount to Parkside Lodge. Huge thank you to all of the teams involved in making sure that went smoothly. And the mother and baby unit that was at the Mount is in the process of being re-equipped to be able to support the patients in the Mount that have got COVID, that have got a high level of physical need. And that work should be complete by the end of next week. With a view to that becoming operational next week, from Monday next week. We just need to sign off the final plans. I did want to dwell on this though, and there is going to be a letter going out to staff, which we agreed from the meeting that we had this morning. As you can appreciate, that you know, we're facing some day-to-day issues in terms of staff not being able to come into work and asking staff to move at short notice. That's part and parcel. I think staff that work on inpatient units, that'll not be an unfamiliar experience. But I appreciate that because of the impact of COVID, it can be anxiety provoking for staff. So I just want to reassure everybody, we only do that when it's absolutely necessary. Our managers have a really difficult job balancing staffing across wards to make sure everyone's safely staffed. And in effect, you know, they're doing what we need them to do. It's making a reasonable request to ask colleagues to move to other areas in order to ensure everywhere's safely staffed. We had some difficulties this morning that have been resolved, which is why I thought it'd be helpful if I write out to all staff to reassure them. So if you've got any specific concerns or queries, anything more that we can do to make you feel safe and secure when we're asking you to go and cover another area, just please voice them to the person that's asking you to move or to your line manager, because the more feedback we get on what we can do to make things as safe as possible for you, the better. We've now got in place really robust stock management arrangements for PPE. Those stocks are refreshed every day, so no area will ever go below, on their site, a minimum of 72 hours worth of stock. We then have still got the additional stock that we keep at Roseville Road. So we're managing it in a way so that everywhere's got sufficient for what they need for several days in advance. And we've always got a backup stock so that people don't run out, because we know that's something that we don't want staff to worry about. And I certainly don't want to be worrying about whether staff have got sufficient PPE for them to do the job safely. So one of the other areas I just wanted to talk about today is, you know, the fact that we are in uncharted territory, and how do we support one another in that we're breaking our usual habits of working. So us doing these kind of Zoom calls is very different. The amount of work that we're doing remotely, working from home, not coming into our usual place of work, changing our working hours to fit around those that have got caring commitments at home, the balance of home life and living in a lockdown environment, and how do we keep ourselves safe. And I think we need to support one another with this. So how do we make sure we always use technology where we can for remote meetings? And if you've got any issues with that, asking our IT support to help us with it. Only visiting our sites and services wherever necessary. And framing it in a way of what's the absolute critical reasons that I need to be present in this area, this clinical or this office area to do my job. And then we know what the obvious areas are our wards providing direct care. We've physically got to be present. But if you've got things that you want to help us generate a bit of a toolkit or a checklist to help us, because a lot of it is around staff feeling that they've got permission to do things differently. I know from speaking with colleagues, it's that people feel guilty if they're not sat at the computer the typical amount of hours a day. You've always got to respond. We need to support one another to continue to adapt for what is going to be a much longer period of working in this way than any of us would have anticipated 4 weeks ago. So I'd be grateful for suggestions of any teams and areas that feel as though they've got this cracked, any advice they'd give to colleagues and other parts of the trust, what the rules you'd want us all to follow in terms of doing everything we can in terms of social distancing, working in a different way in order to keep every single one of us as safe as possible. And then if you do need to be on site, these are some things I've already talked about. So making sure where it's necessary, you wear the appropriate protective equipment. Whilst we're on site, I'm in Trust HQ with 2 other people, maintaining that minimum 2 metre distance rule. We don't all need to be sat in the same room for a meeting, and encouraging others to do the same. And that's where we need to make sure that we're giving people the tools of the job to make sure that's possible to maintain those rules. So these are some of the photographs that we had in last week and some of the other work that's going on. I'd really encourage as many of you to share some of the fantastic work that you're doing. You can see there Jill delivering Easter eggs over the weekend. Hopefully you'll have all seen that we've got our very own Joe Wicks giving us the YouTube sessions with the physio workouts. There's loads of examples and I'm picking some of them up through social media. And what I'm trying to do as much as possible is where I'm being made aware is just to send those thanks and appreciation to each other. So if you've got examples that you want to share, because whilst these are difficult times, we need to make sure that we continue to collect all of the examples of what everybody does every day, which is just fantastic. The sense of team and a real spirit across LYPFT, whilst we might not all be together physically, really comes across strongly. The extent to which our staff are going above and beyond, we're all incredibly proud of. Every single one of us on the board is incredibly proud of. So please keep those examples coming through, and we can collect them and send our own appreciation and thanks for people that you want to shine a spotlight on, knowing that they're going above and beyond, making a real difference to you and the people around you. Okay, so these are some of the questions that you have sent in the past week. I'll just move my screen a bit so I can see them all. So understandably, a lot related to workforce and infection prevention guidance. So what is the Trust doing to encourage staff to work within the same unit? So in particular, this would be our bank staff, rather than moving from unit to unit daily. So we absolutely want to minimise the extent to which staff are having to move around. And we did agree a couple of weeks ago that where staff at wards have got bank staff that they want to block book in advance rather than covering it shift by shift, that's exactly the right thing to do, and that the temporary staffing support team are there to enable you to do that. So we'll make sure that gets fed back out through the sit rep calls as well, and reinforce that through the workforce meeting that's happening tomorrow. Are there any incentives in place to encourage temporary staff to work multiple shifts where there are staffing issues? We've not done anything over and above in terms of incentives. That's not been something that we've had to look at the moment. I'll ask the workforce group to have a look at that, and if people have got specific ideas of what they think would be most beneficial, please send them in. But that's certainly not something that we've had to do at this point in time. Staff have been very much stepping in and on a goodwill basis, helping us out where we need them to do. Next question, what are the agreed plans for infection control cleaning of wards, contact points throughout the day, and has this been confirmed with Interserve? So I know last week we had a number of issues in terms of the cleaning arrangements for some of our wards, and I'll just be really honest, again this comes back down to people being anxious and concerned and worried about, are they safe if they're going into our inpatient areas and cleaning where there's cases of COVID. Absolutely they're safe if they follow the PPE guidance and the training that we've been giving to all of our staff. So we've been rolling that staff out to Interserve as well. They are colleagues like the rest of us, and we've got a duty to make sure that they are well informed of what's going on in our inpatient areas in terms of those patients that are COVID positive, that we give them the right kit and equipment in order to do their job safely, and that we need to absolutely maintain the same standards of cleanliness across all our inpatient areas. Miles Calloway has been having daily calls with the Interserve manager each day just to make sure that all of that's going to plan, and as a point of escalation for any issues that occur on any of the wards. And we agreed that a representative from the Mount is joining that call each morning, and also from the physical health team. So again, if there's any specific issues, make sure the ward manager's aware of it, but we have now got that oversight arrangement in place. Final question, what is the process for placement of nursing COVID positive patients within acute inpatient services? So our clinical teams and our service managers have done a huge amount of work site by site to put in place an approach which is, in the first instance, how do we safely manage somebody in the same environment through basically social isolation in the same way that you would do at home. Where that's not possible, for whatever reason, specific to that individual patient, what are the alternative arrangements we've got in place? And again, those are very specific to each of the sites. It is being updated and refreshed in line with the learning that we're getting from where we have had positive cases. And where do we need to have different areas in terms of the use of the CAU, for instance, at the Becklin, if we need to cohort a number of patients. And that's part of our plans to repurpose the mother and baby unit at the Mount to create a dedicated area if there's enhanced physical care needs. So absolutely, there is a plan. That's been agreed and signed off by the clinical leads and the service managers. If you've any queries or concerns, just make sure you check in with your ward manager because they know what the plans are for your particular area. In relation to the Newsome, we've not got one ward for containment of patients at the Newsome. Those of you that work there know that it's quite a mixed clinical group in terms of PICU, forensic services and adult eating disorder, and the rehab and acute ward that's there. So from a From a clinical point of view, given each of those client groups is very different, and certainly with the forensic patients, there's the added issue of the level of security that we need to support people in. We couldn't create one ward because that would create a whole other set of issues and risks for our clinicians to manage. So again, there's a plan in place for each of those wards at the Newsome as to what is the appropriate way for that particular client group to safely manage them if they've got COVID and reduce the risk of others being exposed to it. That's it. So we managed to do that within the time. Thank you very much. Like I reiterate at the bottom, there's the inbox. If there's any specific questions that you want us to pick up and be able to respond to next week, more than happy to do so. I reiterate again, a huge thank you. I know a lot of people were working over the bank holiday weekend in addition to the day job to make sure that we've got robust arrangements in place. As I've said, we're now actively managing the outbreak of COVID within our areas, and I just am hugely impressed by the absolute focus that's given to keeping our patients and their individual needs at the centre of everything that we're doing, and that's a real testament to the values and the culture of our staff in this organisation. So thank you very much. Please keep following the rules. Those haven't changed in terms of social isolation yourselves. Only come into our premises if you need to do so. That might not feel easy, but it is an instruction. This is about doing everything we can, both personally and professionally, to keep every single one of us safe, and that includes you and your own families. So I shall look forward to hopefully seeing some of you again next week. Thank you very much.